This is News Channel 3 at 6.
Fact is, this is a worldwide problem.
President Trump, as you hear, declared a public health emergency on opioids today. That directs federal agencies to use grant money already in their budgets to combat the problem. Now, that's a little bit different from declaring a national emergency, which is what he initially promised to do. That declaration would have freed up money from FEMA to fight opioid overdoses.
We can be the generation that ends the opioid epidemic. We can do it.
Many experts say Trump's action is more appropriate than declaring a national emergency. They say FEMA's budget is meant to fund short-term relief from natural disasters.
So how big is this crisis? Well, 64,000 Americans died from opioid overdoses last year. That's quadruple the rate in 1999.
Yeah, that's huge. And Tennessee accounted for a little more than 2.5% of those, with more than 1,600 overdoses claiming lives.
WREG's Troy Washington spoke to those working on the front lines of the opioid crisis right here in the Mid-South about what the president's declaration means for us. Troy?
Stephanie, obviously, they basically mentioned that this points out that there is a problem, but it doesn't mean immediate change for them. President Trump himself saying that we've never seen anything like the opioid epidemic. Now, I talked to a lot of people who say if that is the case, put the money towards fixing it. The opioid epidemic has reared its head to the point of getting the president's attention, but even though it's reached the steps of the White House, some feel acknowledgement isn't what's going to shut the door on addiction.
Without the appropriation for more funding for treatment, the overdose deaths are going to continue to rise.
On Thursday, President Trump declared the epidemic a national public health emergency instead of a natural disaster. The difference in the distinctions being the immediate access to funds to fight the problem.
We're setting in a facility that's the solution, but we have to have the funding to run that facility. We have to have the funding to care for them the way they need to be cared for.
Raising the question to those on the front lines in treatment centers, helping to heal those battling addictions, like Stacey Dodd, who is the director of operations at Turning Point Addiction Campuses. If the goal is to end the epidemic, why not put the money into the plan?
But being a former addict myself, I know that we need treatment. When you're an addict, you need treatment. And in order to have treatment, you have to have the facilities to provide treatment. You have to have nurses, you have to have doctors, you have to be able to care for them in a special way.
A national disaster declaration could have summoned immediate help from FEMA, and even though those funds are typically used during natural disasters, Dodd feels 64,000 opioid-related deaths in 2016 does call for immediate attention.
Yeah, his own opioid commission that he appointed recommended to him that he declare a national emergency.
For now, the public health designation will stand, and while treatment centers are grateful, they say it won't end the war just yet.
We just really need the help. We need the funding for the treatment. We have the solutions in place.
In about 15 minutes, in a partnership through Hearts for Hope and Healing, that panel will be full of people, law enforcement officers, as well as Director Rawlings. So we'll keep you updated throughout this call for action. Reporting live in Cordova, Troy Washington, WREG News Channel 3.